All right. So I'm Mick Falkel, Chief Medical Officer at On Pharma. On the phone, I've got the famous Mike DiTolla. We went to dental school. He was a year behind me. I'm class of 87 at UOP. He's class of 88. So we've known each other for a long time. Mike's had an illustrious career. He was 15 years in private practice. He was with Glidewell for many years, and then he went on to Sirona. Now he's doing a few other exciting things, one of which is becoming an expert in PPEs. So, Mike, I'd like to turn it over to you and ask you this very question. We have a new slogan, which is seat, treat, and complete. And that's stay with the patient because of the PPE issues. What do you think about that?
Well, Mick, thanks for reaching out to me. I think everybody's going to have to become sort of a PPE expert from this point on. But this is the first time I've heard seat, treat, and complete, and I really like it. It's like set it and forget it. It's one of those memorable things that you'll never forget. And I've been on board with this for a long time. I was frustrated and reached out to you years and years ago about missing lower blocks and having to wait and coming back in and to give a second lower block and hope that wouldn't work. It was just a huge time suck. And so I got involved with buffered anesthetics at your behest years ago. And I've pretty much loved them since day one. I'm a little bit of a wimp myself, so I always want to use the strongest local anesthetic that I have, the nuclear option or whatever it might be. I want something strong. And the great part about buffered anesthetics, as you know, is it doesn't rely on the patient's body buffering it. You buffer it outside the mouth and you're injecting the active anesthetic molecule into the patient. You get almost immediate feedback whether it's working or not. And literally you can give a lower block and set the syringe down and pick up the handpiece and start prepping. And to me, this is when I'm at my most efficient. If I get up out of that room to go do a hygiene check, I'm going to get dragged a couple other places while the patient just sits there. They don't appreciate them losing that time. They'd rather get in and out of there in 50 minutes rather than an hour 30 because I had to go do these other things. And to your point, in a world where we're spending upwards of $20 on PPE, do I want to have to get a new gown and a new mask and go in and out of the room while I'm waiting for anesthesia? I'd much rather do what we're able to do in the maxilla, give the anesthetic, see that it's working, and start the procedure and finish it, or get to the part where as a dentist, I can leave and my assistant can finish it. So seat, treat, and complete makes a lot of sense to me. It always has, even back in the day, but certainly now with PPE and the patient's perception of us getting up and leaving to go do something and coming back is going to be different than it ever was before, because we're going out, and if they hear our voice in another operatory or interacting with somebody else, I have no doubt they'd rather have us come in, start with them, finish with them, and then be gone and keep it to that single exposure.
Well, and I think you're right. If a patient can be in your office for less time right now, that's going to make them think they're safer. And one of the things about what we're coming back to as the new normal is we've got to convince patients that they're safe to come back. So they're going to we have some pent up demand, but when it comes to hygiene and things like that, we're going to have a lot of people that are going to worry about safety. And if we're in and out of the room, breaking infection control along the way, they're going to be thinking about that where they weren't thinking about that before. And I think dentists will be thinking about that very thing as well. So conserving on PPEs, making the experience as healthy as possible, I think is the thing that we have to all focus on. So seat, treat, and complete is a good portion of that. And I think that it's nice we have something that will help us do that. I know you're an incredible comedian and you would have enough jokes to tell people when you sit down, give them anesthetic, and if you had to wait around, but I'm not that funny a guy, so I'd rather be able to give them anesthetic and get started if I could. So
it's still just, even if you're telling jokes and they're laughing, it's still just, you're just kind of filling wasted time, for that lower block, waiting for it to soak in. So yeah, at least you're being entertaining and they might leave in a better mood than they got there in. But, there's been a lot of articles in the paper on the news recently about grocery store employees and their high rate of COVID-19. And to me, it's all about spending 8 hours in a supermarket versus 25 or 30 minutes of exposure while you're in there to get the groceries you need. And there's no way that patients aren't going to feel even more so about that at the dentist. I don't go to the grocery store and lay on my back with my mouth open for an hour. This is an area where patients, I think, are going to feel vulnerable. And if we can come in and sit with them and take care of the work in the shortest amount of time possible without leaving, and then we leave and our assistant finishes up, or we dismiss the patient without the reception area, we should take care of financial arrangements ahead of time so they can leave right, just pack by, no contact at the front office, right back out to their car again. All that kind of streamlining is going to be to the benefit of the patient, if not just for perception only, which is probably enough reason to do it to give them confidence to come back, but the walking in, saying hello, drop the anesthetic in, start the work, and finish it as quickly as possible with as few interruptions as possible of you having to go out and come back in, I think is an absolute step in the right direction to start to build confidence in a patient population, especially when we needed to come back for elective procedures.
Absolutely. Well, it sounds like you're on board. Got to spread the word. Seat them, treat them, and complete them. Used to be drill, fill, and bill. Now it's seat, treat, and complete.
I hated drill, fill, and bill. That was just I never liked how that. It felt so demeaning almost to dentistry, like it was dismissing it down to these simple things. So seek, treat, and complete, though, is more of a quality guiding principle
Right.
than a lazy way of describing what they do. And I remember telling you once that my dad was one of the first people who I saw really into seek, treat, and complete. Except he wasn't using buffered anesthetics. They hadn't been invented yet. This was while I was still in dental school. So this back probably 1986 or 7. I'd watch him give a lower block, set the syringe down, pick up the handpiece and start working, and the patients start jumping. And he'd say, "Oh, we're almost done. Don't worry." I'd be, "Oh my God, we're nowhere near almost done." So this might get him to come out of retirement, Mick. He's been retired for 28 years now. But the fact that, and I've lived it myself, you can give a lower block with one carpule. And if you go slow and pace it over 1 minute so you're not hurting the patient, you know whether or not it's working, and you can begin treatment right away. That's always, in my mind, been worth doing, but certainly now in this new PPE age of trying to minimize risk to ourselves, our staff, and our patients, this is a great new reason for people to consider buffered local anesthetics.
Well, that's awesome, Mike. Thanks so much for your time. Thanks for everything you do for dentistry. And there's a lot of people that look up to you, and it's for good reason.
You too, Mick. Thanks for everything.
All right. Take care. Thanks, pal.